Hello, friends. Welcome. You are dropping in on another one of our extended conversations. These are mental health awareness conversations. This was born following the Mental Health Awareness Breakfast that's sponsored by the Black Hawk-Grundy Mental Health Center. It's a fundraiser, actually, for Black Hawk-Grundy Mental Health Center. And in our 2023 edition, we had a panel of experts. And we talked about at the breakfast how there was so much to share, just so many really good nuggets of information that all of our panelists had. And so we've taken this opportunity to have these extended conversations, and we're inviting our panelists back to just dive a little deeper into some of the things that we've talked about. And today, I'm really excited. I've got Alyssa Fruchtenicht with us. And Alyssa, thank you for joining us.
Thank you for having me.
Yeah. Well, at the Mental Health Breakfast, everyone at the tables, all of our audience had an ability to just read about the bios of everyone that was on the panel and learn more about them. So for the benefit of our listeners and viewers today, can you just tell us a little bit about yourself and how you ended up at Black Hawk-Grundy Mental Health?
So I am the manager of behavioral health services at Black Hawk-Grundy Mental Health Center. And a part of my role here is I oversee our school-based therapy team. I oversee our outpatient mental health therapists, and I also get to be project director for a grant that we received from SAMHSA, and I get to oversee the implementation of that project. And on top of all of that, I get to be a school-based mental health therapist out in the schools, and I go to East High 1 day a week, and I've done school-based therapy since I started here.
Wow. I was going to ask, when you were talking about those different hats that you wear, I was going to ask, do you still get to see clients?
I do. I see clients in the school setting, and I get to see clients outpatient here at Black Hawk-Grundy Mental Health Center as well.
Oh, good.
Yes.
So how long have you been with Black Hawk-Grundy Mental Health?
I just entered into my year 11.
Wow. So what is it about Black Hawk-Grundy Mental Health that has you wanting to stay?
Yeah.
You're on this team long term.
I joke that I'm the intern that never left. Because I am the intern that has never left. I started here at Black Hawk-Grundy Mental Center as an intern in our school-based therapy program. So when I went to UNI for my master's degree, I took 2 internships, and my final internship was here at Black Hawk-Grundy Mental Health Center, and then I was hired on as a school-based mental health therapist after that. I oversaw the school-based team, and then I, became a school-based therapist, and I got to, oversee the outpatient team and get to kind of have these different roles over the years. And it's really given me an opportunity to see so many facets of Black Hawk-Grundy Mental Health Center, the care that we provide, the way that the teams work together to be able to best meet patient needs, the way we collaborate and support each other, the environment and the team that is here at Black Hawk-Grundy Mental Health Center, and the way that we've grown. And we've grown and creatively worked to meet patient needs in climates that are hard at times. And I think that continues to keep me coming back every day. And I truly enjoy getting to wear multiple hats and being able to be, making decisions about how the mental health center runs and operates, and different, decisions about various programs, but also getting to be a therapist and be involved in direct patient care. I get to provide licensure supervision for those that are working towards their independent license. I get to have interns that I get to train. And so all of those pieces are really big bucket fillers for me, and things that I truly, genuinely enjoy to do. And that I get to play kind of all the different roles throughout the week. Really, I enjoy that personally. And I also really strive and believe for the mission that Black Hawk-Grundy Mental Health Center has in supporting really vulnerable, at-risk populations that really need support, and the ways in which we do that.
That's beautiful. So you were talking about getting on with the school-based programming right when you started with Black Hawk-Grundy Mental Health. Can you tell me about, what was that partnership? How did that get started? Were you in when it was first starting? Or
So when I first started here at Black Hawk-Grundy Mental Center, we were well established in Waterloo schools providing school-based therapy. We've been in Waterloo schools since 1990.
Wow.
So that relationship had been long-standing.
What did it look like back then?
We started small. We had 1-2 school-based mental health therapists at 1-2 buildings, and then we've grown and grown and grown over the years. If we've seen grant dollars be able to come in and get allocated, as we've seen the districts be able to have enhanced funding to support school-based mental health services, we have grown to, I have 14 school-based mental health therapists spread between 2 districts in the Waterloo and Cedar Falls schools. And so that's been really, really neat to see that growth. My first year here, our school-based program served 112 students. That number has stuck with me over the years. And this last school year, the program served just shy of 800 students. And so as we continue to build and continue to talk about mental health concerns, we just increasingly see students get referred, and we serve students kindergarten through 12th grade. And so we know early intervention and early access to care really makes a difference. And so wanting to be a part of that in the school setting has been really neat.
So I'm guessing in your position, you're also involved in strategic planning, kind of where are we going from here?
Yeah.
And it's Hawk-Grundy mental health, right?
Yep.
So we have another county, and you're talking about Waterloo and Cedar Falls schools.
Yeah.
Even within Hawk County, or even maybe trickling into Grundy County, have there been discussions about this model that you have here and taking it to school districts beyond Waterloo and Cedar Falls?
I think it was 2 years ago, I had the opportunity to present at what's called Iowa's Best Conference. And it's school districts that come together and share information. It's through the University of Iowa, helps to sponsor that. We have that opportunity to present on the model of care that we use in the school setting and how our model maybe differs from other models in other parts of Iowa or in other communities. We've got lots of school-based mental health happening in Iowa, rural districts utilizing agencies to be able to come in and provide this care in a similar way that we do. One of the things that sets us apart is Cedar Falls and Waterloo's funding that really helps us to be able to meet the needs of students in a way that's not financially impactful to them. We get to provide therapy free of charge to the students, to their families. They don't pay anything for the care that we provide. We use a lot of blended, braided funding to be able to connect them to services, whether it's district funding, Medicaid funding, other grant funding, Cedar Valley United Way funding that we get that helps us to support these positions and the services that we provide. And being able to do that for families and ensure there isn't a cost barrier to that is really important for me in this program.
Yeah, one of the other themes that we kind of touched on at the Mental Health Breakfast was breaking down barriers.
Yeah.
And we definitely talked about money being one of those barriers. I think also with school-based counseling, just thinking about some of the barriers that people may have tapping into and utilizing services of a mental health counselor or therapist or a social worker doing sessions with you is actually getting there. Well, you're going to the schools, right?
Yeah.
The kids are there. So, that's another barrier that's been broken down. It's like we don't need to find transportation. We don't need to make sure that they're getting to their appointment. They're right there in school.
Yeah.
Can you talk to me about how the whole process even starts? Kind of walk me through sort of typically how a child ends up being one that is served by one of the therapists in the school.
So we have a really strong partnership with school counselors in the districts that we're in, and they're actively out there with students all the time. And they are our primary referral source. So they're identifying students who may be struggling, have something that's going on. We've tried other interventions in the school setting and really working with their own internal district teams of, at what point do we make a referral to mental health services? And so we really lean on the school counselors and the administrators to identify those students, to talk to the parents and guardians about the concerns that are being identified and the resources available, and school-based therapy being one of those resources. The parent has agreed that that's a referral that they want to be placed. That is at that point that we are given information about the student. And then we follow up. We have an intake coordinator named Maddie who assists us in following up with parents to obtain informed consents to treat, releases of information, all of the same forms that would be completed to seek outpatient care here at Hawk-Grundy Mental Health Center. We get those in the school setting because we are still Hawk-Grundy Mental Health Center. My chair sits in the school. And so once we're able to have that, we make contact with the parents. We talk about the concerns. We gather social history and background information. We meet with the students and start getting them on our schedules and start carrying out and providing care from there and collaborating with other entities as we have releases and permission to do that.
Wonderful. That's just wonderful. So when I look back on my graduate training in counseling, one of the things that I noted was a shortcoming once I was out in practice was realizing that our clients don't always know how to utilize what we're offering, and particularly children. And I worked with I had teens were really the level that I was working at, and at a behavioral health center. We didn't have the benefit of being in the schools way back in those days. And so I'm wondering, how do you get students comfortable with this process of utilizing a helping professional that way? And then I want to touch on the confidentiality of it too. You know, it's a lot different when you have a child who has parents or guardians versus an adult, and what confidentiality looks like. So getting those kids comfortable, and how does confidentiality play into that?
You know, I think one of the really great parts of our school-based program is the partnership we have with school counselors who helped us with warm handoffs.
Warm handoffs.
There are warm handoffs happening at every point of the referral.
Goosebumps. I love that, warm handoffs.
It starts with the conversation the school counselor has with the student and the guardian about the school-based therapy that we provide. And then that information being handed to us, and that student and parent knows what's coming next, that they're going to hear from us to obtain consent forms. And so we have found that with those warm handoffs, we've flipped and had way more parents accept and acknowledge and sign up for care. When it was probably 7 years ago, our point of referral to accessing services rate was like 40% of those that were referred to us followed through accessing care. Okay. It was lower than what we really would want it to be.
That's interesting.
And so as we've honed in this warm handoff process, and the school counselors have been such a strong partnership for us, that we have flipped that, and we're at 69-70% of referrals go on to access care with us.
Wow.
And some of that is, they don't access care because they have other sources, or we talk to them about the options, or we are recommending something else that would be a better fit for their needs. And so that has really changed how that whole process looks, and the benefit of that, a trusted adult in the school setting, the school counselors, the administrators, making that recommendation and having that conversation, and then us, following up from there in a predictable manner, also sets us up right out of the gate to have a foundation to build a relationship. And then we have conversations with parents about what it is like to be seen in the school setting. What goals do they see for their young person? What do they hope is different? How can we work together in this? Confidentiality, its limitations, the times I have to tell you things, the times, the ways that I'm going to call you, but how do you reach out to me when things have come up? And then we have that same conversation with a young person about what to expect and where it is that they would like to see different in their world. And I think, we have such a stellar team of therapists here at the Mental Health Center and all of our departments and all of our staff, that we build those relationships. And because we want to, and we are good at providing such quality care, and we care. And I think that sets a tone from those first contacts, from the time a school-based referral speaks to Maddie and gets that welcoming, to the time a patient calls here at the Mental Health Center and talks to a support staff and gets that welcoming. We've really set it up to be a welcoming environment where we can create trusting dynamics.
That's beautiful. And so I'm imagining that, a student is referred, you go through all of this process that you've just described, they get assigned and start building that relationship with that school-based therapist, and it feels good. They found a place where it's a safe place to be processing things that are happening in their lives. Does that sometimes result in them saying, hey, I have a friend who, does that happen? I would think it would, that they would want this for their friends too. Yeah. So how does that go?
And we talk to them about, connecting with their school counselor, encouraging their friend to talk to their school counselor about what might be happening here, or talking with their parent about what might be going on. Because ultimately we have to have parental consent in order to meet with someone for mental health services. And so we help kind of guide them through what needs to happen next in order for that to be. Because also there are times where interventions in the school setting meet a student's needs, but many times that can meet a student's needs. And so that's where really we lean on those school counselors and administrators to do tier 1, tier 2 interventions and to try that with students. And before we are considering a mental health referral, we want to least restrictive kind of resources to be implemented. And so we will explain to students what to expect. Sometimes students will self-refer. They'll walk down and say, I really feel like I need to meet with a mental health therapist. We'll gather some information from them, explain what, the parental consent piece of that. Is that something you want to go home and talk to your parent about, that this is something you're interested in before I call them, or you just want me to call them and explain that you stopped down today, and working with that young person about what are our best next steps here.
Wow, right from the start, the student, that child has some self-determination there.
Yeah.
They're having a say in how this unfolds.
Yep. Yep. And maybe they're not ready for their parent to know, or there's things that are other components here, and we can connect them back to their school counselor to talk about what might be happening, or they can help facilitate that conversation. Maybe they have a different dynamic. And
so I'm guessing then your school-based therapists are also an important source of support and resources for the guidance counselors.
Yeah, vice versa, right? We have things that we collaborate with them on that students might come to us with that's not in our area of expertise. Yes. That we need them to be like, that's not my world. Do you know how to could you help this young person with that? And that collaboration gets to go both ways in order to best meet these students' needs.
Yeah. So something else you mentioned, you were talking about honoring this whole least restrictive environment and taking a look at what services the child is getting in school right now, and what's available, prior to actually coming in. That brings to mind, sort of the world that I'm in both personally and professionally. So my youngest daughter, who's an adult now, is deaf. She's functions as a hard of hearing person. She has cochlear implants. She just really functions as a hearing or hard of hearing person most of the time. And as she was going through school, as the parent, I knew nothing about deafness and hard of hearing when she was born. As 95% of children that are born unable to hear are born to people that know nothing about hearing impairment. One of the things that we learned along this journey is the impact that particular disability has on the mental health of these children. And I said she's an adult now. I have a nationwide network of parents that I have come to know. Mm-hmm. And I'll tell you, Alyssa, I have yet to meet a parent who has a child that is deaf or hard of hearing reach their teenage years without having some significant mental health struggles. Yeah. So when you're talking about students in the school district that are, receiving services for this and that, have you noticed anything with populations that have a disability of some kind, whether it's deafness or visual impairment or autism or anything like that? Have you focused any energy on that or recognized anything about that?
I will tell you that's a population we haven't had a lot of experience serving in the school setting. On occasion, but not enough to kind of gather a pattern or, what do we typically see here, because we're not seeing that population access our services for one reason or the other. I don't know that I know enough to kind of articulate why that is, that might not be happening, or that might be, what the difference is there. But I think too, when it comes to the training of mental health providers, when we talk about different populations that might access our services, some of that takes enhanced training and knowledge to understand how mental health and that disability or that difference intersects in the mental health world. And so that's something we have to be aware of, some of our own limitations. Sure. In our training field, and how we best connect someone to a service provider who maybe does have more experience in one area or the other.
Yeah, excellent. So you also mentioned earlier about they're not, eliminating the barrier of cost. And when you were talking about that, you were saying not just the services that this child receives while they are a student in school, but also family sessions. Can you talk to me more about that? Are there a good number of students who have a parent or guardian or parents or siblings coming into what has that looked like? Yeah,
so we welcome when appropriate and when recommended by the therapist to have the parent come in or the guardian or support person in their world who's providing their care to be a part of this treatment process. And that invitation can look different in different treatment modalities, and it can look different in different family scenarios. We have lots of phone conversations with parents, but in terms of, an in-person session, we've got a group of therapists that are trained in Theraplay.
I was going to ask that. I'm glad you brought that up.
Yes, and so they are doing MIMS and, doing parenting, kind of assessments of this dynamic and through a really kind of systematic, neat way that they are able to provide that care and then have follow-up sessions. We've got, parent-child interaction therapy and what that looks like and how we're able to assess for that. So it's really, as the therapists have these modalities that they've been trained in to identify the best fit for the patient and the presenting need, collaborate with the guardians and parents about what that recommendation is and how do we invite that kind of collaboration through which means is determined best at that point. But we know that we don't want to serve students in a vacuum because they have other parts of their world that are impacting their lives, and how do we engage those other parts in meaningful ways, whether it's in-person sessions, it's sessions here at the mental health center after school hours, we're available all summer. And so we invite a lot of sessions over the summer. If you can't get to us, we can see you virtually. And so we do a lot of that collaboration on site, at school, during the school day, after school hours, over summer, over holiday breaks, over school closure days, to make sure that we're continuing to provide that care and whatever means possible. We offer groups. We do a lot of really neat things that continue to provide care and make sure we're meeting student needs.
Oh, that's wonderful. So we sort of explored a pathway, utilizing referrals that are coming out of the guidance office, mm-hmm. or students walking in themselves, or students referring another student, that kind of thing. I'm imagining it might be possible that there is a child who wears an effective mask while they're at school. Mm-hmm. Perhaps school is a safe, an enjoyable, good place for them to be, but they might be experiencing struggles when they're outside of that school setting. So if that's the case, and there isn't a teacher or a guidance counselor or anyone at school picking up on any signs, can you talk to our listeners, our viewers, about what are some things that we can be looking for in the home environment with our children, and maybe even at different phases of development or different ages? What are some things that we should be watching for if as a parent or an aunt or an uncle or a daycare provider, like what kind of things should we be looking for that we think, something's happening here?
I think we look at, for those shifts from what we see as typical for that young person. Maybe they did really well academically and now their grades are starting to slip. You used to spend a lot of time with your family and your friends, and you're spending more time in your room. You're more reactive and explosive to things than what you had been in the past. You're more emotional, than what we had seen from you before. Or you've, always been emotional, but now it's at a different level and it's about more things than what it used to be. So we really look at what's typical and kind of a baseline for that young person. And always taking into account developmental changes that happen over time, and those having ranges of typical as well. It's typical, to be a teenager that doesn't spend time with your family as much anymore. It's not so cool to do game night. But I'm going out and spending time with my friends as a replacement. We'd see that most often as typical. Now I'm not spending time with my friends or my family and a lot of time in my room. We're going to want to pay attention to this. And so I think when we have parents or loved ones that are concerned, we always encourage to reach out to other collaborative sources. If you've got things you're noticing on your radar and you're just wondering what might be happening here, reach out to school counselors, reach out to teachers, talk to your primary care provider, talk to other loved ones about what they might be observing. And that really kind of helps to raise that awareness and have a conversation with the young person. I've noticed that. I am concerned about, and being able to have open and honest conversations, even if they're not receptive at the time we try. it still opens the door and sends the message of we can talk about hard things and we can do it in a loving and supportive way, and we're here for you. And I notice, I care, and I notice.
Right. And sometimes that might be enough, just a child being heard when they didn't realize they need to be heard.
Yes.
And so a parent contacting, whether it's a professional or another person, saying, this I've noticed, do you think I should worry about that? Yeah, you might.
Yeah.
And then having that conversation with the child.
Yep.
Yeah. Okay, so knowing the span that you've been doing this work in schools, I'm going to toss out social media at you. So this is something that, kids are there now.
Yeah.
They're there. And my feelings about it are primarily negative, but I get, and again, on the deaf, hard of hearing side, social media, because it's digital, it's written, actually kind of leveled the playing field for communication between kids. If I'm texting everything, then I don't need an interpreter, to be sharing information with a peer that doesn't know sign language, right? So there are ways that social connectedness in some populations, I think, definitely is a positive thing, but I don't really like it. So talk to me about what you've seen and the impact that social media has had on some of the kids that you have the honor to be working with in the schools.
I was, kind of doing a little bit of research a few weeks ago, and, they were talking, but there's been new reports that have come out about suicide rates and the mental health kind of crisis among our youth. And so much of that data kind of identifies this 2010 to 2011 shift in rates of depression and anxiety and suicidal thoughts and, deaths by suicide having done this kind of market increase, and the pandemic having amplified problems that were already stirring and brewing in there. And there's been data points that have connected that as, one of the kind of most researched things has been social media's pickup about that same time. And so I think that social media has an impact on our youth. We know that. That's been evidenced, and that's been, researched and continues to be researched. There are also ways that social media can be a positive impact for young people. And so I think we have to be cautious about what that looks like for that young person's life. Risk factors and protective factors that are not already in place, and how social media and access to social media can amplify and impact some areas where there maybe already was a struggle. And now we're seeing things on social media that are further stemming that struggle. And so I don't think it can be classified as all bad or all good.
Right.
But it definitely has to be approached with caution and education and understanding and awareness about how social media can affect us, especially as we're seeing young people get access to phones younger and younger and younger. There's a campaign out there that's delay till 8th. And just even the benefit of waiting till 8th grade to have access to a phone and social media, and the drastic difference that can make in how we function and how we perceive in our mental health.
In your perspective, talk to me about how that 8th grade, that age point, is a good one for parents to consider as a reference, because they're going to get arguments from their 5th, 6th, 7th graders, right?
Yeah.
So help arm our viewers, our listeners. Can you give us some rationale why, sorry, honey, not till next year.
We have more brain development that occurs throughout middle school. Middle school is a tough time.
Oh, the hormones.
To begin with. And so waiting until we have more brain development and there's more independence that's already kind of naturally happening that warrants this need to have a connective device. But I think, too, there's just a different degree of development in who we are as a person that can happen throughout middle school and be at a different stage come 8th grade. More awareness about maybe who we are as a person, or who we're trying to be, or the interests we have, and figuring out our friend groups that can start to happen and be a little bit more solidified. And so I think the more we can delay that, the better it is. But I also know that there's a lot of challenges to that. There's feeling left out because I don't have a device, and that's how my friends are connecting, and then I'm not invited to things, and those get really, really tough to navigate.
I mean, even to adults it is. I think I read an article about I think it was an NBA basketball player that preferred having a Droid phone, but they have some team chat and his bubble was a different color, and so he had to get an iPhone. It's just amazing.
Yes.
The breadth, the trickle out effect of how social media, how it beautifully pulls us together. Yes. I do appreciate how well it can pull certain groups together. Yes. But I'm glad that you're able to support the kids through any of the struggles.
There's a lot of resources for parents out there about social media usage and how to do it in a way that has monitoring and apps you can download that help you monitor what's happening on your child's phone. And sometimes these kids are just smarter than us parents and know how to circumvent things and get around it, and so all of that kind of stuff. I think the more parents can be informed and educated about the best practices in implementing a phone for their young person, the more safeguards we have around this, and the more open conversations we should be having about technology and its role, both good, bad, and indifferent.
Yeah. So now I want to kind of move forward in the experience of a student who is taking advantage of these services. Yeah. I imagine at some point it may be that a student is doing well enough that they don't have the need to schedule additional, at whatever greater age they are, that they may not have a need to schedule resources. Talk to me about how they or their parents are instructed if things come up. I want to touch on that. And then I'd also like you to describe what happens when a child graduates, from these Waterloo or Cedar Falls schools, and they've been relying on this support that they've had without having to go anywhere, right? They're at school and it's right there. Talk to me about both of those transition experiences.
So we get the pleasure of being able to discharge patients from care because of goal attainment. Yay. Right? And being able to, set out this treatment plan with a young person, work with their family, see the goals obtained, and kind of come to the celebratory stage of we have completed care at this point. And so those are always fun experiences to be a part of and to hear about from the team. And they love being able to have a discharge and being able to reach that point. And so we work with the family about, I always say that we talk about discharge and goal attainment from the onset of services. Right? How will you know that you're ready to be done meeting with a therapist or that we've reached the goals that you've set out to achieve? So it doesn't come as a surprise when we get to that point because we've had those conversations ongoing throughout the stages of treatment. And so we see it as a celebration and helping them, remind them of the other supports that are in place and how to contact us again should other needs arise, how to follow back up, how to reach back out to get connected again should they need to, or are the resources in the community, and or connecting with the school counselor in the school setting to let them know what we've reached and that they continue to be a resource for them.
Right. And it doesn't take away from that celebration, right? You had these goals, you met these goals, you've had this discharge. Yay! Needing to tap in again, whether it's for similar goals or something completely different, doesn't take away from that celebration of that accomplishment, the progress that they made.
Yes, absolutely. And if someone gets to, if we're seeing a senior, we see them through the summer after their graduation. So if they graduate in May, we'll see them through August until the next school year starts. And we help hand off wherever their next treatment provider is going to be if they're not discharging from care. And that might be at a college, university that they're attending to that has on-site services, and we help them find those resources. It might be to a therapist here at Black Hawk-Grundy Mental Health Center that we're helping to hand them off to. It might be to another therapist in the community. And so we collaborate with that young person as we're nearing the end of that care about what their options are, what it means for them. Virtual care has kind of changed the game a little bit with that. Yeah. We used to have to help them, help them figure out how are you going to get there if you're, going to be employed at this place, and what's that going to look like? And now when we can connect them to virtual providers, that helps also remove that barrier for them. That's been an area of success too. So we make sure that they have a plan before they're ending services with us, and we can hand that off in whatever way that they feel like would be best for them.
That's wonderful.
Yeah.
So these are students who have, sort of set these goals. You're helping them build their resilience. They're, just doing really well, and they have their discharge from services.
Yes.
And you're hoping that they maintain those practices that they, utilize the tools that they have. One of the things that I've been asking each of our panelists when we're going through these extended conversations is, what do you do yourself? Separate from your clients here at Black Hawk-Grundy Mental Health Center, separate from the kids that you're seeing in school, how do you tend to yourself and keep feeling healthy, mentally healthy and fit?
I have 2 young boys at home, and I always say that they didn't ask for me to be a mental health therapist, so it's not fair if I come home and am carrying all this stuff from work with me, because at the end of the day, they want their mom to be their mom. And so I am really cognizant of the boundaries that I have placed that help me to take care of me. And it may sound really silly, but I try to physically separate my work day from my home day. The first thing I do when I get in the car is put my hair up in a pony. I'm always having a band on my hand, because that's just like my signal that I'm not at work
Taking
anymore.
Off the uniform.
I change my outfit out of my work clothes. The first thing I do when I get in the door, within minutes, I'm in a totally different attire. Wow. And that is really signals to me and my brain and my body that I have shifted roles here.
I love that.
I will often take a midday walk here at the mental health center over my lunch. If it's nice out, or especially if I've had a particularly stressful day, I will either take a lap internally or a lap externally as a way to kind of bilaterally process what has happened, or what it is that I'm stressed about, or what stresses that I'm holding in, or if I need to think of something in a different way. I know that walking helps me to be able to do that. And I think too, being able to have other professional supports to call up and to have experiences with, or vent about things, or share, the tough parts of our days has really helps to make sure that it's not being carried around, because we hear tough things, we encounter tough things, we make tough choices at times, that we do have to be cognizant of how it's affecting us. And have a support network for what that looks like. And I use walking a lot. I use resources a lot, professionally, other leaders here at the mental health center that I can lean into if I need to, other coworkers who are therapists that I can lean into. But I really I don't have email on my phone, because I just know that I can't get those dings all the time and be separated. So I set those boundaries for myself and have gotten much better at that over the years than when I first started.
Wonderful. That's wonderful. Wonderful advice to share. Well, Alyssa, thank you so much for joining us for this, and it's been wonderful to be able to share all these nuggets. It's such a great program, and I really am glad that we've got listeners, and even those listeners and viewers that are outside of Waterloo and Cedar Falls schools. You made reference to a lot of districts. Across Iowa and beyond have this available, and if they don't in their school, it's something that maybe they can be talking to their school board about, and what can we do to get this kind of thing going for us. So thank you very much for sharing. And thank you all for dropping in on our extended conversation. As a reminder, the Black Hawk-Grundy Mental Awareness Breakfast is a fundraiser. It's, we utilize it to gain more resources for programs like Alyssa has been describing. So I encourage you to look at show notes. There's a place that you can click into, tap into, QR code, however it is on the way you're accessing our podcast today, that you can contribute as well. And we have set already May 10th of 2024 will be the next mental health breakfast. So I encourage you to watch for announcements about that and join us in person next time. So thank you all for dropping in today.